Hello everyone, happy to see you in the next video. We are going to discuss about tetanus today. I'm Jansi, tutor working at M College of Nursing. Objectives. At the end of the session, the listeners would be able to describe what is tetanus, causes of tetanus, pathophysiology of tetanus, symptoms, its diagnosis, treatment, nursing care of tetanus, its complications and the prevention. So now let's move on to the discussion. Definition. Tetanus is also called as lockjaw and a serious infection caused by Clostridium tetani. This bacterium produces a toxin that affects the brain and nervous system, leading to stiffness in the muscles. Causes. Tetanus is caused by a toxin made by spores of bacteria Clostridium tetani found in soil, dust and animal feces. When the spores enter a deep flesh wound, they grow into bacteria that can produce a powerful toxin called tetanospasmin. The toxin impairs the nerves that controls the muscles, that is, the motor neurons in our body. Moving on to the pathophysiology, Clostridium tetani is found in the soil, dust and animal feces. So the bacterium produces a potent neurotoxin called as tetanospasmin, which interferes with the release of neurotransmitters in the central nervous system, which particularly inhibits the release of gamma aminobutyric acid, that is GABA, leading to continuous muscle contraction and spasms. So thereby the infection typically enters through a wound, usually puncture wounds, lacerations or deep cuts in our body, and then it can also occur from burns, surgery or even dental procedures. This is the pathophysiology of tetanus. Moving on to the symptoms. As the picture clearly indicates, there will be lockjaw, involuntary muscle spasms, nothing but hypotetanus, that is involuntary muscle spasms, stiffness of the body, seizures, sweating, fever and headache, difficulty in swallowing, changes in the blood pressure and heart rate, respiratory failure and opisthotonus. Incubation period, typically it ranges from 3 to 21 days depending on the severity and the location of the wound where it's exactly present. Diagnosis. A thorough history and physical examination should be done to the particularly exposed potential sources of Clostridium tetani patients and the characteristics of the muscle spasms. Lab tests include, there is no specific test for tetanus. Diagnosis is mainly clinical, but blood cultures may be done to identify Clostridium tetani in some cases. Treatment. The initial management includes TIG, that is tetanus immunoglobulin. This is administered to neutralize the toxin and prevent further damage to the body. Wound debridement, that is cleaning and removing necrotic tissue from the wound site to reduce bacterial load. Antibiotics such as penicillin or metronidazole, cephalosporin, tetracycline, vancomycin are used to treat the infection. Symptomatic management includes muscle relaxants and sedatives. Medications like diazepam, barbiturates are used to control muscle spasms and prevent the complications. Supportive care includes intensive care might be necessary for respiratory support if the diaphragm is affected. Pain control. Analgesics may be prescribed to relieve the pain associated with muscle spasms and the rigidity. Vaccination. TT or Tdap. So that is nothing but tetanus toxoid. If the patient has not been vaccinated or their vaccination status is unknown, they may require a shot of tetanus vaccination. Monitoring and prevention of complications. Airway management, it includes respiratory complications. Continuous monitoring of the airway and respiratory function is essential to rule out Seizure precautions. Due to the risk of severe spasms or seizures, appropriate measures should be taken, and autonomic dysfunction monitoring, that includes tetanus can affect the autonomic nervous system. The motor neurons can be affected, so it requires a close monitoring of the vital signs. Moving on to the nursing care, assessment includes continuous monitoring, assess wound site for signs of infection and necrosis, monitor for signs of respiratory distress and impaired swallowing. Prevention of complications include aspiration and respiratory complications by ensuring an open airway, administer oxygen if necessary and monitor the blood gases, provide sedation and muscle relaxant as prescribed to manage pain and spasms. Patient education. Educate the patient and family about the importance of completing the tetanus vaccination series. Teach wound care and how to prevent the infections. Explain the need for follow-up care, especially if there is an incomplete tetanus vaccination history. Complications include cardiac arrest due to increased catecholamines level, brainstem damage, palsies of phrenic laryngeal nerves due to toxic effect, respiratory muscles, apnea, vertebral fractures or intramuscular bleeding due to opisthotonus, that is arched back due to the contraction of the back muscles. You can see the picture here. So the patient will get similar symptoms. Arched back due to the contraction of the back muscles will be the prime complication. How can we prevent it? There are 3 levels of prevention: primary, secondary and tertiary. Primary prevention includes vaccination at 2 months of life with booster dose, and 4, 6 and 12 to 18 months one shot, 4 to 6 years the next shot, between 11 to 12 years the booster dose, and every 10 years once one shot to be given. Secondary prevention, vaccination, antitoxin after the injury can be administered immediately after the exposure. Tertiary, vaccination and antitoxin after tetanus presentation. Once the patient present with the symptoms of tetanus, then we can give a shot of vaccination. This is how we can prevent tetanus. Conclusion: tetanus is a preventable but dangerous infection requiring a very quick intervention. Nursing care focuses mainly on preventing the complications and managing the symptoms. Also, it includes provision of supportive care and educating the patient on vaccination and wound care. So, tetanus is the only vaccine preventable disease that is infectious but not contagious from person to person. I repeat, tetanus is the only vaccine preventable disease that is infectious but not contagious from person to person. These are some of the references. Thank you.